Hello dear friends, I Dr. Shamsher Singh welcome you all on my YouTube channel Pharma Learning. Today I am going to start GPAT question series, and this question series will be very useful for the candidate who are appearing in the GPAT. And I will start the first question. The first question, which of the following is released in traumatized tissue, causes pain and edema, and is inactivated by angiotensin converting enzymes? So the options are angiotensin 1, angiotensin 2, arterial natriuretic peptide, and bradykinin. So which one is the correct answer? You can comment in the box. So the correct answer for this option you can choose. The correct answer is bradykinin. So that means bradykinins, they are useful in case of the patient or the person who suffered from the trauma, and in this tissue where there will be edema, excessive pus formation, and inactivated by angiotensin converting enzyme is the particular protein is bradykinin. So you can like, subscribe, and watch the Pharma Learning channel. The next question for this GPAT series is, in cotrimoxazole, sulfamethoxazole and trimethoprim are in the ratio of. So the options are 2 ratio 1, 1 ratio 5, 1 ratio 1, and 5 ratio 1. So you can choose which one is the correct ratio for sulfamethoxazole and trimethoprim, because they are used as sulfonamide and useful for the gram positive bacteria. So you can choose and comment the correct answer for this question. The correct answer for this question is 5 ratio 1. So that means the sulfamethoxazole will be in the ratio of 5 and trimethoprim will be in the ratio of 1. So the next question for this series is, which of the following statements describe hemorrhagic cystitis? So where you can find that if this type of statement where you can say there will be a cyst as well as there will be a blood, that means bleeding from that area. So the option for these questions are, it is caused by excretion of tumor cell breakdown product, it associated with ifosfamide or cyclophosphamide administration, it caused by administration of Misna, can be treated with GCSF. So you can choose the correct answer for this, you can comment in the box. The correct answer for this question is, it is associated with ifosfamide and cyclophosphamide administration. So because these type of the cytotoxic drug, when they are administered in the body, many a time you can say there is a swelling in the particular tissue, and that tissue, once it is torn up, once it is break, there will be a excessive, you can say, fluid which is released from that area, and sometimes that fluid also contain a blood and it is appeared like a cyst. So the next question for this GPAT series is, select the drug which can improve urinary flow rate in benign prostatic hypertrophy without affecting prostate size. So the option for this question are amphetamine, prazosin, finasteride, and goserelin. So you can choose the correct answer for this question and you can comment in the box. So you choose the correct answer. The correct answer for this question is prazosin. So you know that prazosin is a alpha blocker, and the alpha blockers are used in prostate hypertrophy. So that's why the prazosin is a correct answer, where the patient suffered from a difficulty to move the urine outside because of increased size of the prostate gland, and which affect the urinary outflow in many of the patients. So prazosin is a correct choice for this question. So the next question for this series is, why benzyl penicillin is ineffective in gram-negative infections or the infection caused by gram-negative bacteria? The options are: it destroyed by penicillinase, which is secreted by gram-negative organism. Gram-negative organism do not utilize delanin, which incorporate is inhibited by benzyl penicillin. The lipoprotein peptidoglycan cell wall of gram-negative organism prevent entry of penicillin, and all of the above. So you can choose the correct answer for this question. So very shortly you can choose which will be a correct answer for this. The lipoprotein peptidoglycan cell wall of gram-negative organism prevents entry of penicillins. So that means the peptidoglycans which are insoluble in water and they are hard, they are a part of the cell membrane of microorganisms which are of gram-negative type. That's why these type of the penicillin, benzyl penicillin, they are ineffective on these type of the infection caused by such type of bacteria. So you can like, subscribe and watch the Pharma Learning channel. The next question for this series, two port domain potassium ion channels are opened by which on one of the following categories of anesthetics? I will again repeat the question. Two pore domain potassium channels are opened by which one of the following categories of anesthetics? The options are barbiturates, benzodiazepines, opioid analgesics, halogenated inhalation anesthetics. So you can choose the correct answer and you can comment in the box which one is a correct answer for this question. The correct answer for this question is halogenated inhalation anesthetics. So that means these halogenated inhalation anesthetics, they are having this property that they open this type of the channel, and whenever they open potassium channel, they reduce the nerve conduction velocity. That means they reduce the propagation of nerve, in turn they reduce the pain sensitivity. So these type of the compounds are useful in this particular conditions. So what will be the next question for this series? The next question of GPAT series is, meloxicam belongs to which class of non-steroidal anti-inflammatory drugs which are called as in NSAIDs? The options are preferential COX-2 inhibitor, selective COX-1 inhibitor, preferential COX-1 inhibitor, and selective COX-2 inhibitor. So you can choose the correct answer and you can comment in the box. So the correct answer for this question, you choose very fastly. The correct answer is preferential COX-2 inhibitor. That means meloxicam is not a selective inhibitor for the COX, because celecoxibs are the selective inhibitors. But meloxicam is the preferential COX-2 inhibitor, and these COX-2 inhibitors are useful as anti-inflammatory agents to reduce inflammation in the body. So you can like, subscribe this Pharma Learning channel. And the next question for this series is, which of the following drug may inhibit the hepatic microsomal P450 enzyme responsible for warfarin metabolism? So the option for this question are cimetidine, ethanol, phenobarbital, and procainamide. So you can choose the correct answer for this. The correct answer for this question is cimetidine, and cimetidine was the drug which was responsible for the hepatic microsomal P450. It inhibits this metabolism of warfarin, and the second, this cimetidine was outdated drug withdraw from the market due to its anti-androgenic effect. That means cimetidine inhibit the function of gonadotrophin in males. So that means there are two answers for this question in this particular series. So what is the next question for this series? The next question for this series, which of the following drugs displaces plasma protein bound phenytoin as well as decreases its metabolism? The option for this question are carbamazepine, sodium valproate, cimetidine, and chloramphenicol. Now the correct answer for this question you can choose very fastly. The correct answer for this question is sodium valproate. It means sodium valproate displaces phenytoin plasma protein binding and reduce its metabolism. It indicates that valproic acid valproate, which is an anti-epileptic drug, which is sodium channel inhibitor, calcium channel inhibitor, and it also optimizes the GABA functions, is useful drug, and it displaces the phenytoin from the plasma protein site. Now the next question for this series is, which of the following drugs possesses antiplatelet effect? So antiplatelet effects are required in atherosclerosis, in case of diabetes, in case of cardiovascular problems. So the option for these questions are erythropoietin, urokinase, desmopressin, clopidogrel. So you can choose the correct answer for this, that which of following drug can be useful as an antiplatelet drug. The correct answer for this question is clopidogrel. So clopidogrel is used as an antiplatelet in cardiovascular problem, in atherosclerosis, and in some other problem where there is a excessive increase in the triglyceride and cholesterol level in the blood. So this clopidogrel is used as a beneficial drug to inhibit the platelet, that means aggregation of the platelet in the blood vessels. So the next question for this series is, dose response curves are used for drug evaluation in the animal laboratory and in the clinic. Quantile dose response curves are often. The option for these questions are used for determining the therapeutic index of a drug, used for determining the maximal efficacy of a drug, invalid in the presence of inhibitors of drug being studied, and obtained from the study of intact subject but not from isolated tissue preparations. You can choose the correct answer for this. The correct answer for this question is used for determining the therapeutic index of the drug. So that means these ex vivo type of studies which we do on the isolated tissue is basically to check the lowest amount of the drug, the potency of the drug, the therapeutic efficacy of the drug, which can be useful for the in vivo conditions. So this is a correct answer for this question. The next question for this series, receptor for dash 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 are DNA binding proteins. The option for this question are steroids, retinoids, vitamin D, all of the above. So you can choose the correct answer very fastly. The correct answer for this question is steroids. So that means the steroids they act on the DNA binding protein. That means the steroids acts through the nuclear receptors. So they act on the nuclear level. So this is a correct answer for this question. The next question for this series is, a 50-year-old man has history of frequent episodes of renal colic with high calcium renal stone. The most useful agent in the treatment of recurrent calcium stone is, the options are mannitol, furosemide, spironolactone, and hydrochlorothiazide. So you can choose very fastly which one is the correct answer for this question. The correct answer for this question is hydrochlorothiazide. That means hydrochlorothiazide are the useful agent in the treatment of recurrent calcium stones. So that means they reduce the calcium deposition at the particular area and they can be the useful, and that's why there is a one side effect of this drug thiazide, hypokalemia, low level of calcium. So they are useful for this type of the conditions. So the next question for the GPAT series is, which of the following amino acid is inhibitory neurotransmitter and increase the membrane permeability for the chloride ions and thus causing inhibitory post-synaptic potential in the CNS? The option for these questions are glycine, glutamate, aspartate, and all of the above. So which one is a correct answer? Which one is a amino acid is an inhibitory in nature? The correct answer is glycine. Glycine is an inhibitory neurotransmitter which act through opening of potassium channel and thereby reduce the potential generation at any nerve or any neuron. It means it produce inhibitory post-synaptic potential, reduce the nerve propagation and nerve generation, neuroconduction. So this is a correct answer for this. The next question for this series is, Metoprolol is a cardio-selective beta blocker, relatively selective beta 1 blocker. So the option for this question are with membrane stabilizing effect and with partial agonism effect, without membrane stabilizing effect with partial agonist effect, without membrane stabilizing effect and without partial agonistic effect, with membrane stabilizing effect and partial agonist effect and direct vasodilator activity. So which one is a correct answer for this option? The correct answer is without membrane stabilizing effect and without partial agonistic effect. So that means metoprolol is a cardio-selective beta blocker which block the beta receptor and useful in a cardiovascular problem like hypertrophy and CHF or some other conditions. So this is the option for this particular drug. The next question for this series is, the prokinetic effect of metoclopramide can be abolished by. Options are vagotomy, atropine, bethanechol, acetylcholine. So very fastly you can choose the correct answer for this. The correct answer is atropine. Atropine inhibits the prokinetic effect of metoclopramide. Why? Because atropine is an anticholinergic drug and it reduces the GIT motility in the body. So that's why it inhibits this particular effect of the drug. So the next question for this series is, for optimum rehydration, the molar concentration of glucose in oral rehydration salt ORS should be equal to molar concentration of sodium, somewhat lower than molar concentration of sodium, somewhat higher than molar concentration of sodium, or 3 times the molar concentration of the sodium. So very fastly you choose this correct answer. The correct answer is somewhat higher than molar concentration of the sodium. So because the glucose which is added along with ORS containing sodium is due to the effect that glucose increase the sodium absorption in the blood. That's why ORS contains sodium as well as glucose. So the next question for this series is inhibition of thromboxane synthesis by aspirin in platelet lasts for 5 to 7 days because the options are aspirin persists in the body for 5 to 7 days, aspirin induced depletion of arachidonic acid for 5 to 7 days, regeneration of aspirin inhibited cyclooxygenase for 5 to 7 days, and platelet cannot be generated fresh thromboxane synthase and their turnover time is 5 to 7 days. So very fastly you can choose the correct answer for this. The correct answer for this question is platelet cannot generate fresh thromboxane synthase and their turnover within 5 to 7 days. So that means this thromboxane synthesis is inhibited by aspirin, and aspirin, you know, it is a useful drug as an antiplatelet and useful in various vascular problem as well as cardiovascular problems. So the next question for this series is which of the following statement is true regarding cholestyramine? The options are inhibit free fatty acid release from adipose tissue, release lipoprotein lipase, it block final step in the synthesis of cholesterol in the body, and when used in a large dose it decrease serum cholesterol level. So what will be a correct answer? Very fastly you can comment. The correct answer is when used in a large dose it decrease serum cholesterol level. So that means this is the effect of mechanism of cholestyramine. It reduces the serum cholesterol level, and cholestyramine is used as a hypolipidemic agent in atherosclerosis and other cardiovascular problems. The next question for this series is which preparation of vitamin K should not be injected in the newborn babies? Again, I will repeat the question. Which preparation of vitamin K should not be injected in the newborn babies? The options are phytonadione, menadione, menadione sodium diphosphate, both B and C, menadione and menadione sodium diphosphate. You can choose very fastly the correct answer for this question. The correct answer for this question is both A and B, menadione along with sodium menadione phosphate. So these were the questions which I have discussed in this lecture for the GPAT series. Hope this series will be very useful to all of you. In the coming lecture series, I will discuss more and more concepts related to pharmacology, and you can like, subscribe the Pharma learning channel, and you will get more and more video in the coming time. If you will be having any comment, you can send your comment in the comment box, so that accordingly we can do this type of the thing and we improve your GPAT question series. This you can say preparation for the GPATs. So you all are welcome. Thank you very much.